Today, here we are, the silent threat, exploring pollution's impact on health. So the objectives of this session are to develop a common understanding of the impact of pollution on our health and to gather all the initiatives that are tackling this issue. We'll dive into real examples, especially from low and middle income countries, to see how we can turn things around. Before we start, here's a question for you, and we'll do this for every panel. So let's see the question. How many premature deaths worldwide are associated with ambient air pollution and household air pollution annually? Well, you can just scan the QR code on the screen and choose from the answers provided. You'll then receive a message on your smartphone with the correct answer. At the end of the session, we'll give you the results and tell you if you got it right or wrong. So grab your phone and let's get started. It's now my pleasure to welcome on the stage the moderator of this panel discussion, Diana Rizzolio, coordinator at the Geneva Environment Network. Please join me. This network brings together more than 75 organizations to advance environmental and sustainable development initiatives. After you. Have a nice session. Thank you.
Can you hear me? Yes, it seems it's working. So may I invite the other co-panelists to join me? I generally moderate events and I introduce panelists as I give them the floor. There's a lot of light, so I don't see who is in the room. Which is not that bad. Thank you very much. So welcome to this first session of this year's Geneva Health Forum. As you have heard, this first day is dedicated to health and environment, and we will focus during this session on the silent threat to pollution, exploring pollution's impact on health. I am Diana Rizzolio, as it was mentioned, the coordinator of the Geneva Environment Network, which is the oldest of the thematic platforms of International Geneva, supported by Switzerland to foster synergies among the over 100 institutions or secretariats based in Geneva and other stakeholders that contribute to the global environmental agenda, and we have a few of them here on this panel. You see on the screen that there is an additional name. Sadly, David Azoulay had to leave for an emergency to France and won't be able to join us this morning. So I would like to start by thanking the Geneva Health Forum to have associated us to the preparation of this session. And I'm joined this morning by various leading experts that I will have the pleasure to introduce as I give them the floor, as I mentioned earlier. Our leaders today refer to the triple planetary crisis that the humanity currently faces of climate change, biodiversity loss, and pollution. Member states have adopted global deals that brings agreed goals and targets for each of these crises. Today we are discussing the pollution crisis. This is an important topic for International Geneva, which is a hub for global governance solutions to this crisis, with the presence here of key institutions such as the Chemicals and Waste Conventions that are administered by the United Nations Environment Programme. We have the World Health Organization that is represented here today, and many others. So through the food we eat, the air we breathe, and the water we drink, we are intimately connected to nature and in turn exposed to a cocktail of pollutants that have a range of effects on our health, as we will hear from our speakers this morning. So 2 years ago, an international team of researchers concluded that humanity has exceeded a planetary boundary related to environmental pollutants, including plastics. And according to the scientists who contributed to the findings, the rate of which these pollutants are appearing in the environment far exceeds the capacity of governments to assess global and regional risks, let alone control any potential problems. This said, multilateral solutions are being developed by member states and other stakeholders at the World Health Assembly that kicked off this morning, at the World Environment Assembly, and in other international negotiations that some of you here in the room also regularly attend. So to formally welcome you to this session, I'm joined this morning by His Excellency Ambassador Fernando Espinaza Oliveira, who is the Deputy Permanent Representative of Mexico to the United Nations Office and other international organizations in Geneva. Mexico tabled last year at the World Health Assembly a resolution on the impact of chemicals, waste, and pollution on human health, together with other member states, including Peru and Switzerland. Mexico is also very active in numerous environmental negotiations aiming at tackling various crises, including pollution. So, Excellency, let's hear from us how you are welcoming us here today.
Thank you.
Thank you.
Is the microphone on? Yes, thank you. Thank you very much for your kind introduction. Good morning to everybody. Guten Morgen. Bonjour. Benvenuti. Benvindos. It is really an honor to share this morning with such a distinguished panel and to open this event to address one of the world's most urgent problems, which is pollution's impact to human health and the environment. And a full disclaimer, when actually it was brought to our attention, this quiz, I have to confess that I do it my research, and I just scanned it, and probably I'm wrong, because it is actually more terrible from what I had expected, actually, the number of people dying every year as a consequence of pollution. And it is very meaningful, as it has already been said, that this particular event is taking place during the opening week of the World Health Assembly. When I was invited to come to this event, I was very attracted by the title, The Silent Threat. And I had to remember a very old philosopher, Austrian philosopher, Ludwig Wittgenstein, which had a very specific approach to the concept of silence. Worüber man nicht sprechen kann, darüber muss man ja schweigen. We cannot actually talk from there are things that we cannot talk, and we should stay silent. And this is not the case, luckily enough, because we are experiencing a silent threat, and I'm very glad that we are discussing this particular issue from a scientific perspective, because that's one of the main challenges that I can see, not only in international Geneva, but all across the world. There is some sense of skepticism regarding scientific findings, and it is the time that scientists, policymakers, diplomats, civil society will work together defending the results of science. And we have a scientific approach in order to get results. So, many people around the world, as we know, die every year because they live on unhealthy environments. And unfortunately, people with lower incomes are more likely to live in polluted areas and have, for instance, unsafe water. So, we are pleased of having chosen this topic to open the Health Forum, pollution. And this is not only due to the relevance of WHO's critical role in protecting health and well-being from the harmful impacts of pollution, but also because this is an important topic for international Geneva, as has already been said, home to various organizations addressing this crisis. I love coming to the biotech every now and then, because precisely here at the biotech, we have the Geneva Science for Diplomacy Anticipator, which is an institution which is trying to tackle from a scientific perspective all the major issues and try to contribute from a broader perspective with many international organizations from a scientific perspective. So this is a wonderful venue. As we'll be discussing this panel, science has demonstration that pollution is contributed to a major planetary crisis. This international urgency of taking action on pollution, including chemicals, as it was mentioned, and waste for the protection of human health and environment, has recently been reflected in the adoption of several significant resolutions. I will name 3. The impact of chemicals, waste, and pollution on human health, adopted by the 76th World Health Assembly. Second, Resolution 5/14 to end plastic pollution towards an international legally binding instrument, and the Resolution 5/8 to establish a science policy panel to contribute further to the sound management of chemicals and waste and prevent pollution. Both were adopted during the 5th sessions of the United Nations Environment Assembly. And last but not least, the recently adopted global framework on chemicals during the 5th International Conference on Chemicals management. Pollutants, especially persistent ones, have been detected in humans globally in our food, in aquatic biota, high mountain lakes, offshore waters. I just recently read a report that by 2050, there will be more plastic than fish in all the oceans. It is also essential to deepen the understanding of the interactions between health and environment and to address One Health challenges and to urge the key role of WHO to contribute to protecting us from the impacts of pollution of health and well-being to address different challenges, to encourage, as I mentioned, science-based review, research, regulation, and contributions that will lead us to positive impacts and to the achievements of many of the goals and targets of the 2030 Agenda. Without further ado, I wish you a fruitful discussions exploring this silent threat, and I wish you a very pleasant week. Thank you.
Thank you very much, Excellency. I understand that you have back problems, so if you want to go back, then I will call you back at the end. Up to you. So, good. You have mentioned the importance of science for policy, including in pollution, and this is actually the thematic of the next session, so stay with us also for the next session. And for those who don't know, Geneva will host next month the last round of negotiations to develop the equivalent of an IPCC. I mentioned IPCC because everybody knows IPCC for pollution. So, and we'll see where the Secretariat will be based. So let's now continue setting the stage, and I will turn to Richard Brown, who is with the World Health Organization, and we'll hear from Mr. Brown how the World Health Organization and the World Health Assembly are addressing the risks to health from pollution through the interactions between health and the environment. And just to introduce Richard, he works with the Chemical Safety and Health Unit of the World Health Organization. And since 2009, he has contributed to the work of the International Program on Chemical Safety. Chemicals is his specialty. In the area of chemicals risk assessment publications, he also leads the Secretariat for the WHO Chemical Risk Assessment Network. And his background is in toxicology and pesticide registration. Richard, the floor is yours.
Thank you, Diana. And thank you for the opportunity today to talk about what the World Health Organization itself is doing in this important area of the interaction between environment and health. It's been described in the title as silent threat, and maybe not completely silent, but maybe quieter than people think, because an awful lot of people, particularly in the health sector, tend to underestimate the impact the environment can have on health. WHO's own estimates are something like 23% of the global burden of disease, 24% of deaths, which could be prevented, are due to environmental risk factors. These are deaths and ill health that don't need to happen if we do something about those modifiable environmental threats. These environmental factors: air pollution, polluted water, radiation, chemical pollution, the impacts of climate change. It's actually a substantial contribution to the health impact that we have to deal with. If you come to health with only a lens entirely focused on the health sector, on the hospitals and the clinics and treating the patients that come before you, and you don't do anything about preventing health, I think eventually the problem will get away from you, because nobody can treat their way out of this increasing crisis. The focus has to be very much on prevention. And this has been the direction which the World Health Assembly has taken in recent times, and other international negotiations, as His Excellency was referring to, in terms of establishing potentially a treaty on plastics pollution, a forum for science policy panel, the global framework on chemicals, and the World Health Assembly itself giving more and more attention to this issue. As we heard in 2023, there was a resolution on chemicals. Chemicals and climate change are both on the agenda of the Health Assembly this week in 2024, and there'll be a further item on the Health Assembly agenda in 2025. That's 3 years in a row. That's almost unprecedented in the area of environment and chemicals, showing the increasing importance of this issue. Another thing which will be addressed by the Health Assembly this week is the next global program of work, which is kind of the strategic plan that the World Health Organization has for our work in the next few years. GPW 14 is its technical term. It's the 14th global program of work. And that proposes, amongst 6 strategic objectives, 2 of those are on this very topic. One of them specifically on responding to the threat of climate change, and a second strategic objective on addressing the determined root causes of ill health, including environment, social, and economic factors. And so I very much hope that the direction that the World Health Organization is moving is very much in this area towards prevention and promotion of good health. Thank you.
Thank you, Richard. I had a follow-up question on numbers of mortality and morbidity associated with pollution, but you already gave a few numbers. Is there something you would like to add on that?
13.7 million is your grand total. That's a much bigger number than people tend to assume. In the area of chemicals, exposure to hazardous chemicals, which is my specialized area, we estimate 2 million deaths a year. That's much bigger than most people ever think. And that number is both, it's substantial, it's an underestimate, and it's rising. It's an underestimate because we only have good data to make estimates for certain chemicals. We know a lot about lead, which we'll be hearing about from another panelist, which is a large proportion of that. But there are many chemicals where we don't have good data to make estimates, even mercury, which is a well-known pollutant. So 2 million sounds big, but in fact it's an underestimate, and we know it's an underestimate. And it's growing because the use of chemicals is growing, urbanization of societies, increasing consumerization of societies means more people are exposed to hazardous chemicals. The number of chemicals being manufactured and used is estimated to double in the next few years, and so that burden will only ever increase unless we take significant action to address those. So we know something about the numbers. The numbers themselves are alarming, and they're only likely to grow. And one key improvement from the scientific side that we could use would be more research to give us better understanding of those estimates of the burden of disease, so that we can really get this message over that these modifiable environmental factors and pollution are having a big impact on people's health.
Thank you very much, Richard. So we now move in the discussion and look at the health impacts and examples from different types of pollution. David was supposed to be the first panelist to address this, so let me just mention here a few things that he probably would have mentioned in his presentation. So David Azoulay is the director of the Geneva office and of the Environmental Health Program of the Center for International Environmental Law. And this group is very active in numerous environmental negotiations ongoing in Geneva, particularly, for example, the one on plastics. And David that's the topic that he wanted to bring here. So through the food we eat, the air we breathe, and the water we drink, we are exposed to pollution. And David would have liked to bring an example, the plastic pollution, for which the international community is developing an international legally binding instrument. A few points that he had put here is the importance of the recognition that human health and environmental issues are closely interlinked. Is obviously not new, but is getting some broader recognition in global policy spaces. And we have seen that in some of these environmental negotiations, this is really something that we have had to push. As environmental degradation grows due to the triple planetary crisis of climate change, biodiversity collapse, and pollution, health impacts will also grow, and this is something we have also heard. There is still a huge gap between our advanced understanding of existing health impacts due to pollution and environmental degradation, and the several limited and insufficient global policy decisions to address the environmental crisis. So I'm quoting here David. Adopting a human health lens and perspective on these challenges is key to advance adequate policies to address both the three environmental crises and the growing human health degradation. And when we were preparing this session, David mentioned to me that he had recently received, he did some test bloods to test phthalates and bisphenols in his blood. And he really found the numbers are really surprised him. They were so high. And that's the example he would have brought you here. And he would have insist on the lack of transparency and the need for strong global policies. And that's what we are doing here in Multilateral Geneva, is try to adopt the strong policies to go through that. So let's now move to Professor Nino Quensley, who is the former Deputy Director of the Swiss Tropical and Public Health Institute, and also the former Dean of the Swiss School of Public Health. You are Professor Emeritus for Public Health at the University of Basel. You have a 30 years record of research in air pollution and health. Professor Quensley regularly served on policy-relevant committees. He was also part of the Scientific Advisory Board of the Climate and Clean Air Coalition that is hosted at the United Nations Environment Programme. You serve as a WHO Air Quality Guideline Development Group for many years. And you have also been the president of the Federal Commission for Hygiene, the advisory board of the Swiss government for clean air. So you have a long experience. You have also published numerous articles in this area. So we are really delighted to have you on board for this discussion. And with you, we will look at air pollution regulation, which is your specialty, as a positive role model for pollution governance. So could you share with us, Professor Quensley, through your experience, what you have learned, how this regulation air pollution role model can be a role model, and for example, your experience also with the WHO air quality guidelines. Thank you.
Well, Diana, thank you very much. Thank you for the invitation, and congratulations to the organizers of the Geneva Health Forum. It's always a great place. Maybe let me also start with a disclaimer. I mean, given that I have really invested 30 plus years of my entire career into air pollution and health, I'm not saying that this is the only pollution, but, and we had many others we would like to discuss, but I think it is a very nice example to show actually how things work as well. So I have a very positive story, at least 50% of my story is very positive, and we might talk about the other side at the end a little bit. A very, very positive story that tells us how we can have success in the domain of environment and health. And I think we can apply that to also more recent, less known challenges where we are still kind of wondering what's going on. So I have actually four topics, 4 domains that are part of this success story that I want to go through a little bit with you. And I agreed to participate here despite my recent retirement. I thought this is like looking back to what we did in the last 30, 35 years. So the first crucial point, environmental health and air pollution and health, it's the science, and you mentioned it. I mean, we must know what the effects are of those very, very complex environmental challenges. We cannot just call for action and policy without that knowledge. And it is really fascinating to see how the science to understand the health effects of ambient air pollution has evolved over the last 30, 35 years. It's incredible. What is it possible today, particularly in my own field, environmental epidemiology, progress is enormous, and the collaboration with basic scientists, with technologists has improved so much that today there is almost a get-together of basic science, of biomarker science, together with very, very large epidemiological studies to understand what it means to live in air pollution. And I mean, this is a very tough question to understand, that particularly given that we all know, in general, I mean, the long-term effects are really what bothers us. So what does it mean to live in a dirty city for 20, 30 years, to grow up in a city like that? So it's incredible what environmental epidemiology together with the mechanistic studies have told us, have shown us in the last 30 years. It was absolutely very basic what we knew when we started 30 years ago. Actually, in Switzerland, we were launching a very large, still ongoing cohort study advised by the Harvard School of Public Health at that time, because they had a longer history in doing that. So today, the list of health effects that we do know that they associate with ambient air pollution is getting longer every year. I could name many diseases. It started, of course, with understanding the effects on the respiratory system, and soon came the evidence for cardiovascular health. But now we talk about diabetes. Today we talk about health effects of ambient air pollution on the unborn, on mental health, cancer, of course, lung cancer, and other diseases. So this pattern looks actually quite similar to the health effects well established for smoking, which, if you think back, is not that much surprising, because it's also combustion, and ambient air pollution is to a very, very large extent related to ambient combustion. So this evidence is incredibly strong, yeah? And we understand even many of the mechanisms, meanwhile, how these effects actually get triggered. So having that said, we have a second duty in environmental health. We have to ask ourselves whether this is relevant. And you should really understand the science today has become so meticulously efficient in finding very small effects. I was serving on a board on air pollution studies in Scandinavia. They have almost no air pollution in Scandinavia, but they have a lot of money going into that research. So it's incredible. They can still see what it means to have a little bit higher air pollution in a Scandinavian city, what it means on people's health. It means something that you can show. And we know it in Geneva. I mean, air pollution is not anymore the biggest topic, but if today we have more pollution than yesterday, 10 micrograms more in particles, for example, we know that cardiovascular events, myocardial infarction, will go up something like 1%. There is a huge global science that shows that, but is this relevant? So that is the second key element, and you have asked us a question, and you referred to the burden already. It was my very big honor and privilege, actually, to work on the methodology of assessing the burden of ambient air pollution. That was in the 1990s, where the Swiss government asked us to tell them what the burden is. They had exactly this question for prioritizing policies. You should know whether it is relevant. And knowing a 1% increase in mortality by itself is completely irrelevant. I mean, how can you put that into context? So this burden of disease studies, the ambient burden of ambient air pollution from outdoor air pollution is 4 million, and together with the indoor it's like 7 million. These numbers have a science behind, which we had really the pleasure to develop. We had the pleasure to work with WHO at the turn of the century to make sure that air pollution gets included in the global air burden of disease studies. And now this is one of the many, many factors that are there. So this tells us now something very important about the story, namely that this is an important factor. So knowing that, we can take the next step in environmental health. And the next step is really the question how to define now what a healthy environment means, given this science. And there I have to really honor WHO. It's fantastic, the initiative, the leadership of WHO in publishing the ambient air quality guidelines since 25 years is an exceptional undertaking to tell us how air quality should be to protect people's health. Well, why is this so important? Many, many countries have in their constitution or in their regulations laws that actually make this case that we have the right for a healthy environment. So what is that? What is a healthy environment in terms of ambient air pollution? So these air quality guidelines are extremely important, and it was my very big pleasure in my almost last 5 years in my career to work with the WHO Commission to published the newest update. And I have mentioned Scandinavian studies. I mean, given what we know today of health effects in very, very low level of pollution, we had to revise the old air quality guidelines. So if you look into the new ones published in 2021, they are very tough because, yes, we have to be honest and clear, we see health effects of ambient air pollution almost down to zero. We just have no studies down to zero. Yeah, so that's why actually these numbers are not put at zero, but they have shifted down. So this is very, very important, telling the ministers of health, the regulators, how air quality should be to protect people's health. And this is, of course, the leading information for the fourth element. And the fourth element is to set up a policy framework to get there, to get to the point that clean air is actually guaranteed to people. And this is, of course, a very complex science, technological science, and interdisciplinary, multidisciplinary activity of policymakers, of technologies, of industries. And there I have to say, and this is my view on half part of the world, we have an enormous success story to show. It's unbelievable how air quality has improved in almost all Western countries. And even in very bad examples, like I lived in Los Angeles for some years, it's unbelievable. I mean, Los Angeles today is almost as clean as Zurich was 20 years ago, yeah? And the same is true for Mexico. It has a fantastic history to show improvements. When I grew up in the mountains in Switzerland, my air as an elementary school boy was worse than it is now today in the worst traffic-related situation in Switzerland. Yeah. So imagine this. I mean, this is an incredible success story. And of course, now we have proposed to the Swiss government to lower, further lower our targets, and this creates new stress. But that's what the science is demanding, and I think we should go there. And yeah, maybe you want to talk more about the other 50% of the people where we have still problems.
Yes, indeed. What about inequality? You mentioned a lot of examples of people who were still in environments that maybe not that polluted. But what about inequity of exposure and inequity on how we deal with it?
Yeah, I think if you ask me, that is really the biggest next challenge. And promoting again the relevance of science, I really want to promote science, how to resolve that challenge. And that challenge is not anymore epidemiology. That challenge is how to bring the world, the ministers of the environment and ministers of health, those who now have the assembly, in fact, how can they move forward to make sure the message is heard and the solutions are applied, because clean air is possible. I mean, we are not talking about a fantasy, yeah? Not knowing. We have a whole set of recipes what to do, and that's the success story I was saying. But now, if you look more on the global scene, what's happening in terms of ambient air pollution, that is a very, very sad story, and it goes on since decades. Whereas on one side you have all these countries where you see these improvements since many, many years. And of course there is diversity, that's fine, but it's going down, down, down. And then you have all these other countries, be it in Asia, be it in Africa, mega cities in Africa, South America, where you still see not only the opposite trend, it's going up, but actually it's going up on levels that in some countries we have not even ever seen in Europe. And Europe has, and the US, they had terrible air pollution, yeah, in the 40s and 50s. So we have cities in India, in China, where pollution is very, very bad and is getting worse. And sorry, that is unacceptable. So we need the science, we need the solution to make this application of the solutions on a global scale. And of course, there are many dimensions where we know why the problem is going on, and part of it is the responsibility of the governments who don't take action, who don't put on the right standards, the right requirements. But of course, we have this global community of industries who play this game. I mean, if you have a country in Africa that has no regulation, let's say on sulfur or you name it, of course, the refineries who produce the diesel, why would they care? They know how to do it in a clean way, because if they do it here or in Europe or in Switzerland, it's simply forbidden to do it the dirty way. But in those other places, they just do it in the dirtiest allowed way. And the global system is still favoring very dirty technologies in places where they don't have put on the regulations. And that is a very costly avenue. There is this misunderstanding that clean air has a price that we cannot afford. No, it's the other way around. Poor countries cannot afford air pollution. They should keep it clean as urgent as possible, because the health effects and actually also other effects on buildings, etc., on crop, these effects have a far higher economic price than taking care of clean air. So there is this inequity that bothers me very much. As an epidemiologist, I don't have a good answer on it, but all I want to make sure is we should really find solutions on that angle on a global scale. Thank you.
This is also why we have, I am trying to implement multilateral, there's a strong noise, can you hear it? That's also why we are developing multilateral solutions to try to avoid these inequalities. We now move to another pollution. We will speak about lead pollution with Professor Ji John from Tsinghua University, Vanke School of Public Health, where we will also discuss some success stories and many challenges that remain. And actually, lead pollution and the success stories have also contributed to the success stories in air pollution. So John Ji is an associate professor at Tsinghua University, as I mentioned. His research in environmental epidemiology employs population studies to examine the impact of climate and environmental risks factors on health. He has authored also numerous peer-reviewed journal articles featured in high-impact publications such as Environmental Health Perspectives, the Lancet Planetary Health, the International Journal of Epidemiology, and others. He's indeed also a member of the advisory board of the Lancet Regional Health for Western Pacific. And I could also continue with his long biography. And so you are also currently launching a new course on planetary health. So Professor Ji, the aim of your presentation now is to bring us the example of lead pollution, some success stories and some challenges.
Yeah, I'm happy to speak about lead exposure and lead pollution, which is quite a success story in terms of how scientific findings impacted policy and how policy drove some of these new scientific questions. Now, I wrote my dissertation on lead exposure, and I turned it in 2013, so that was 11 years ago. To me, I thought that would be the last paper on lead exposure because everybody else was moving into climate change and new exposures. And lo and behold, shortly after turning in my dissertation, Flint, Michigan in Detroit in the United States had lead exposure from the water pipes. And again, we had a city that was poisoned by lead exposure. When we think of lead exposure, we think it would be a remnant of the Industrial Revolution from the past, but it is not. But lead exposure is also very interesting because lead is part of the theme of today's talk, which I'd like to bring you to the word silent threat. And because of the word silent, we don't know who is being exposed, what is the health attributes of those who are poisoned by lead, until we had technology advancements in biomarkers, in biological markers that made it possible for scientists to understand how to measure what is outside of the body and what is inside of the body. So we could measure lead in the general environment, but without measuring how much lead burden is inside the body, we don't have causal relationships between the biomarkers and health impacts. So a couple of chemistry technology advancements like ICP-MS. Now, if you take a piece of hair, you take a piece of toenail, blood, lead in blood, lead in urine, you can measure the amount of the lead chemical, elemental lead, in your body. So you're able to quantify what is the biomarker burden of lead. And through toxicology studies, we can understand how the body takes lead and metabolizes it and gets rid of lead. So you can understand how recent the exposure was. So for blood lead concentration, the half-life, the half of the biological life is 28 days. So if you have lead in your blood and you don't have any more new exposure, after 28 days, that concentration drops in half. So you're able to understand, is this a acute exposure or chronic exposure? So lots of studies were done using blood lead measurements. And then newer technologies came out. X-rays, K-shell X-ray fluorescence. We're able to look at the bone lead concentration by using a X-ray in the patella or the tibia, which is the kneecap and the shin bone, and we're able to understand how much lead was deposited in the bone, because lead, Pb++, a divalent cation, is a lot like calcium. So we're able to measure what the bone lead concentration is, and that biomarker tells us what the cumulative exposure is over the past 8 years, 10 years, or 20 years. So we're able to measure exposure. And from that, now we know the burden. We need to understand, now we can link it to health impacts. The most famous example of lead exposure is on child IQ. Intelligence, right? We have drops in IQ associated with lead exposure, and that's because of general exposures through leaded gasoline in much of the industrialized West, and also currently in paints in old houses. Old houses use to add lead in paint because it's shiny, it's malleable, and it also is anti-corrosive. So lead was added in paints. Now, some of these old housing stocks have leaded paint, which are flaking off. And lead has a special attribute, is that it tastes sweet to the human lip and tongue. And when children live in a house that has lead paint and is flaking off, they would put it into their mouth because it tastes sweet to children. And that's how, if you look at the old housing stock, you usually have higher burdens of lead in children because they are eating the leaded paints. So in terms of epidemiology, now we can measure how much lead is in the body, and we use big data analysis, cohort studies to see what the average IQ is, what are the behavioral issues, the psychiatric issues of exposure and outcome. And we're able to draw a graph. And that graph is not one line. It's not a linear relationship. And much like air pollution, you have low level of lead exposure, high level of lead exposure. And what is super interesting is that at the low level of exposure, you have higher marginal effect for each unit of exposure outcome relationship. And for the economists out there, then you realize even at low exposure, it is more toxic because of the higher marginal effect. So now we have these epidemiology studies with big data, with biomarkers, and we show this relationship. And still, that is actually not enough. Sometimes to push policymakers to take action, that's not enough because there's always questions of residual confounding. Is this a causal relationship? How do we know it is not because of confounding by socioeconomic status, socioeconomic factors? So this science is not enough. And then interest biology. Interest biology, we're able to understand etiology. So I understand the building we're standing in has a lot of neuroscience research. And it's actually those studies coupled with the epidemiology studies that made a huge difference. Calcium channels in neuroscience is an important channel. So we have action potential from one neuron to another. We have potassium channels, we have sodium channels, and the discovery of calcium channels in long-term potentiation really gave us more understanding of memory formation. How do we learn? Calcium channels are activated for LTPs. And when you have lead exposure in the body, the lead looks almost like a calcium molecule. It binds to the calcium channels, and it doesn't come off, and the calcium cannot bind to those channels. And that explains why there are learning deficiencies and disabilities and lower IQ among children who are exposed to lead exposure. So now we have all the parts in place, and therefore we are able to connect the science and change the policy for a cleaner society. And that's because of biomarkers. But as we move away from lead, when we think about some of the modern exposures, including some of the gases, air pollution, green space, heat waves, we don't necessarily have the biomarkers that we had with lead. So those type of studies also present new challenges that we need to deal with.
Thank you very much. And what about the local context and these questions of inequity to exposure that we have also addressed before?
Yeah. So the local context is important because much of the industrialized world and the developing world now face issues of pollution. A lot of the electronic waste contain lead, and those are often shipped to countries that are willing to take them, see it as a form of economic activity to do recycling. So there are pockets of where e-waste recycling, where lead exposure was detected globally. And we have looked at some of those data, and they are absolutely an issue. I think lead regulation, because we know so much about the science behind it, there are strong, I think, civil movement to prevent exposure, but there are so many new chemicals that do not have such strong epidemiology and biology studies. I mean, those studies take about half a century for these group of people to come together. But chemicals are being invented at a much, much faster rate than lead exposure. Biomonitoring programs are being set up around the globe. Where I live in China, there is the China CDC that sets up the human biomonitoring program for lead exposure, cadmium exposure, selenium exposure, et cetera, mercury exposure. So these randomly sample people from across the country can paint a profile of what the exposure level is within the country. And trust me, it is not evenly distributed. You see higher burdens of heavy metal in places that are of lower socioeconomic status. So I think a lot of it has to come from occupation or consumer products that are not enforced more. So we always talk about socioeconomic status as a determinant of health, but as a mediator in that pathway, you have pollution, and some of these are irreversible neurological damages. Now, on an ambient level, maybe you're lowering the IQ of populations by 1 or 2, which to an individual that may or may not be a lot, but as a population, that's a lot. So some of the potentials of human populations because of heavy metals are not being raised.
Thank you very much. I will soon turn to the room for questions, but I would like to ask a question back to three of our panelists, because I would like us to discuss also the potential for strengthening global action to reverse these adverse impacts, because you all mentioned that it's important that we do more and that we address particularly the inequalities. And there is a lot of work actually ongoing, including in International Geneva, on topics that you have mentioned, just as the e-waste, transboundary movements. There is the Basel Convention here that looks at these things and tries to improve that, and there could be many more examples. But I will first turn back to Richard and ask him how the World Health Organization is bringing its voice in environmental negotiations, aiming at tackling pollution. I know that in some of the resolutions adopted at the World Health Assembly, they specifically refer to engaging with the World Health Organization, for example. Richard, the floor is yours.
So there are a number of these ongoing international negotiations at this time, and some of the UNEA resolutions, in fact, specify a role for WHO.
UNEA is the UN Environmental Assembly.
But what they're really saying is what role that health should have a role in these instruments or treaties that are coming out of essentially the environmental sector. And I think it's an attempt to recognize that there needs to be a role for health. Some existing treaties, for example, the Minamata Convention, spells out a specific role for health within the
Minamata
convention.
looks at mercury, for those who don't know Minamata Convention.
Yeah. And so it's a question which is posed in each case. And it's a subject for negotiation that the member states will have to agree on. What we are doing within the Secretariat is, first of all, consulting both internally and externally. Within the World Health Organization, as an organization, we have our headquarters here in Geneva, and we have many different departments which have an interest in these different things to be covered. For example, in the area of plastics, we have the chemicals. It's relevant to medical waste. It's relevant to the use of plastics in medical devices. There are a lot of different internal stakeholders that we have to consult with, and then external stakeholders in what we think of as the health sector and our health partners, to ensure that they engage with the negotiations for the treaties, and also that they talk to their governments and their member state representatives who will be attending those talks. Even within a government, you want to encourage the health sector parts of the government to talk to perhaps the environment sector parts of the government who will be attending the negotiations, and WHO can help to make those important connections. Likewise, we ask our member states for guidance in this, and the paper which is going to the World Health Assembly this week asks the member states for guidance on the positions that the organisation should be taking within the discussions for the Science Policy Panel and the potential plastics treaty. So by trying to bring together those parties and ensure that health has a place at the table and is talked about in part of the discussions, both internally and externally, is one of the key roles that we think we need to play. But of course, the outcome in the end will be negotiated by our member states, and then we will ultimately be guided by them.
Thank you, Richard. Professor Quinsley, very briefly, could you share what you think lessons that could be implemented from what you have observed in the air pollution regulation world that you have been engaging for so long, on water, noise, tobacco, other pollutions? What are the lessons learned? How could we apply them?
Well, I think the lessons we learn is really that science itself is not enough. So we need the next step, and of course that's the 100 million question: what are the right things? Maybe in my field we sometimes discussed whether we need, like in the tobacco field, a global convention or a treaty or whatever. I think we need to reach the point where the science is getting globalized in the regulations, in the rules. And I don't know how to get there without the help of UNEP and I mean, the
And
UN.
do you see which will be discussed at the next session, the science policy new panel that will bring chemicals pollution and waste, so the sort of IPCC, but for this area of pollution? Do you think that will be useful?
I think, and IPCC, of course, is a good example of saying that a lot can be done to move inertia in the many countries, but it has to become very concrete. And if we don't get to that point, I'm not optimistic that this global divide will ever change.
Thank you. And now, so after John, I will go back to the room. Professor G, living environments and health expectancies has been part of the studies you have been recently doing. Any findings in your research of good policies that could be strengthened?
There's strong correlations between urbanization and rising life expectancies globally, but to tease out what is in there that is driving the causal relationship because urban environments have higher air pollution, higher pollution in general, but the transportation, the chance at income, the healthcare determinants of health are multifaceted, and we have learned a lot from the urban development in the past century, but is that the right type of path that all of the developing world should follow? Is industrial revolution the only path forward? And if so, knowing that we know what we know today about pollution, how do we design, future cities and places to live?
Thank you. So now it's time for questions from our audience. We have lights, so I cannot see where the mics are. Here they are. Any questions that you would like to raise with our panelists? It's my glasses. But raise your hands, and the mics will come to you. So we have some questions at the back of the room, it seems. So I kindly ask who asks. We will take 2-3 questions. If you could introduce yourself, and if the question is addressed to a specific panelist, also to mention that. Thank you.
Good morning, everybody. Roberta Petrucci, Office Cantonal de la Santé, Genève. The question is for whoever wants to answer. I believe that civil society has a strong role to play against the inertia many of you have been talking about. I wonder if you could share some thoughts about how to address communication to the general public to try to balance between rising awareness and this overwhelming and paralyzing feeling that we live in a very dangerous world for which there is very little to do, especially at individual level. Thank you.
So while the mic travels, if David Azoulay was here with us, he would be 100% agree with your comment on the role of civil society. So you have the question in mind. Let's take 2 or 3 questions. So the mic is traveling. Sorry. There's one hand here, also at the front. Yes, please.
Hello. Thank you. My name is Dr. Bronwyn King. I'm from Australia, and I have got a long history in tobacco control, but in recent years I've been working on indoor air quality. And given that so many populations around the world spend up to 90% of their time indoors, I was wondering if I could ask for the panel's views on how the world can collectively move forwards on indoor air quality so that we can all be safe from all the pathogens in the air, but also, as our panellists have pointed out, all of the pollutants that are in indoor air. Many different countries have acted on this sort of independently in the recent year. Many European countries are now getting indoor air quality standards developed. There's a whole range of US states that have done so. It seems to be sort of isolated, and I'm just wondering if the panel has views on how we can better collaborate globally to move forwards to make sure that the air we breathe is safe everywhere. Thank you.
Thank you. Maybe we start with those 2 and then we do 2 more. So who wants, a question comes from somebody based here in Geneva. And
maybe I have a question that links a bit the 2 questions. Indeed, I think, of course, civil society is extremely important. And if you look historically, the whole move of improvements, not only in Switzerland, but in the whole Western world, that was, of course, not just happening. I mean, this was a debate. This was a struggle. I remember in the 1980s, we have created the Physicians for the Environment, and we were instrumental in the civil society movement to call for clean air. And you can follow up that in many regions. Now India has fantastic initiatives of physicians with children communication, big events where they call attention for that problem. So of course this is important, particularly in democracies, because ultimately you need the parliament, a majority in the parliament. And I mean, I could tell you funny discussions the parliament had in the 80s and 90s. But the majority has followed the right direction. So that is very interesting, because ambient air pollution is nothing that you can tackle on the individual level. So don't go back on the burden on the shoulders of individuals who say, well, you must, you should. No, air pollution, ambient air pollution is a problem we have to resolve as a society, and we can. And that links me to your other question of the indoor world. At least in our country, and I think in many democracies, we have a regulatory problem there. So the indoor discussion of the science and linking it to policy lags behind some 20 years. I know initiatives in Switzerland have started. Actually, Antoine Flau is part of those discussions where we promote to move into that model of tackling the issue, because of course, yes, we spend a lot of time indoors and there are a lot of issues one could do better, but there is this challenge in a democracy. The regulation of the indoor environment, at least in Switzerland, is seen as a private issue. And I mean, particularly now with these large fractions in the parliament, the populistic parties, I mean, how can you change policies if people tell, well, this is my own world, so please don't enter into that. So in Switzerland, we are lacking policies addressing the indoor environment. Of course, there are a few in how the material has to be created, that you put in an indoor environment, etc. There has been a lot of progress. But in general, we are far behind, so I don't have a fast answer.
I'd like to speak a little bit about China for the indoor air pollution. I think there's a terminology, indoor air pollution, there's a terminology, household air pollution, and they're a little bit different academically. If I'm not getting it right, if I'm getting it right, household air pollution is, usually referring to people like burning biomass in indoors to cook and for heating. And that causes a lot of pollution in many places in the world still rely on biomass. So in China right now, the debate is about what do we do about household air pollution? So one of the efforts right now is to change from biomass to gas-fired heating, gas-fired cooking. And the newer epidemiology studies are coming out that gas is still a source of air pollution. So now the issue is, do we go from gas to electric? And now that involves cooking habits, like how much heat is generated, are people used to it? And the question is, should there be a leapfrog? Just go from biomass to electric and just skip the gas. So some of these discussions are happening in China.
Ambassador Espinosa?
Mr. Brown just recently mentioned a very specific example, and I think a very successful one, the Convention on Tobacco Control. I remember back in the 90s, when I was working at the Foreign Affairs Ministry, everybody would smoke, but me. So it was very inconvenient to be on a room, on the inside, and be surrounded by people who would see smoking with disregards to a non-smoking person. So I would raise a question, and they say, well, it's not prohibited. Therefore, it is allowed. So, well, from the legal perspective, that might be, but I was aware of the consequences. I was very allergic. So we decided, a couple of colleagues, to organize and to address this matter to the superior, to somebody who was higher ranks, who was a smoker. So obviously the answer was negative. So we raised awareness. And eventually we got something like was at least a designated area for those who would smoke and would go to the room very quietly, not without grudging and not without complaining, but we could do it. Then, I think, was pointed out, civil society is essential because it's one of the stakeholders of all the work we do on international Geneva and on multilateralism. When we listen to your voices, what we do is because civil society, not because just of the sake of entering a negotiation. So it is essential for civil society to organize, to raise their voice, to be heard, and to do the follow-up of the negotiations, being rather on panels, events like this, going to your civil servants, raising awareness, because the tobacco convention would have been impossible. I mean, I remember the lobby of many tobacco companies who would say, well, I mean, there's no scientific data on this. I mean, it could have been could be anything else. I mean, and they would be obviously trying to limit the possibility of such a convention taking place. I mean, and eventually it was signed. And if I'm not mistaken, last year we actually commemorated another anniversary, a very successful one. We meet on the COP, and we're actually trying to get even more successes on this framework. Thank you, that was my comment.
Thank you very much. I was indeed going back to you on this question on civil society, and I wanted to mention here that to address this pollution crisis, member states have adopted last year in Bonn a global framework on chemicals. It's the pact that we have for this crisis. It's the Paris Agreement is for climate change. This is the global framework is for the pollution crisis. And in the governance of this framework, civil society is part of that governance on the answer to pollution. Richard, you want to add something on this?
Just a quick point about the communication with the public. I see that you can link the two of moving to cleaner sources of use of energy and benefits towards climate change. There is a co-benefit. So rather than telling people, this is a bad thing, you've got to stop doing it, you point to them, this is the benefit of doing this. It's not an inconvenience, it's also contributing to the moves towards climate change. And so the message doesn't have to all be negative in terms of what do we say to the public where everything seems terrible. Right. Actually, some of the things that are being proposed to reduce the pollution, to have that co-benefit where, if the message is properly given, people can see this is why they want to do this thing instead of it being something which is imposed on them as a negative.
I see that.
Richard, I'd like to get your thoughts on one thing I noticed in terms of communication of risk from civil society is that I think all media people reporting on health should take a class in Intro to Epidemiology. And the reason I say that is because a lot of the reporting on are relative risks, like comparing two probabilities. You are 5 times more likely to experience mortality if you are exposed to that, this and that creates a lot of fear. But there's also something called the risk difference, which is how many people out of 1,000 does this apply to? And the subtraction may not be such a fear-mongering number, but a lot of the reporting, I think all the reporting I see in the media on this are reporting relative risks, and it gives researchers people don't like researchers sometimes because of it. Yeah.
It's a challenge, but the public needs messages that they can easily understand, and if you need to have a significant understanding of mathematics in order to understand the statement, it's not going to work as a public message. So you need to tailor your message to the audience very much.
But I really have to say, I mean, in the air pollution field, that was a game changer. When we came out with the assessment of the burden, this whole discussion, these stupid discussions about relative risk, it has completely disappeared. And the media were crazy about it. I mean, the first study that made a lot of noise was the tri-national study with talking in Europe, Austria, France, and Switzerland about 40,000 deaths. I mean, this number became a magic number. they were not talking about epidemiology, and you're right, they should have some basic training. But I mean, that translation into telling priorities, people what is important, I think that is a good way of moving forward.
Thank you. I'm looking at the clock. Maybe we have time for a last question, a quick question, and then I would like to turn back to the panel and give them 30 seconds to close. Yes, please.
Thank you very much. I work for the NGO sector in Europe, and I'd like to raise a question about the relevance of science. One of the speakers mentioned that the science generated should be relevant, and when it comes to chemicals, for instance, we know that the pace of development of new chemicals can prevent effective research on the effects of many of them, which may be used very widely by many people in the world. So given the resource constraints existing, which is a reality, which recommendation could you raise on this issue? I'm thinking about, for instance, endocrine disruptors, where we have in Europe discussions about understanding very precisely the routes of exposure and the causal effects before acting. So thank you for your answer.
This is also a good transition for the next panel, which will look at science in pollution.
Well, it's perfectly true. There's already 40,000 chemicals or something like that kind of number, tens of thousands already in use, with 1,000 or more chemicals brought into use every year. And the volume of chemicals being developed and used increases all the time as well. So it is a challenge, and it's not really a recommendation, but you can't wait until you have 100% evidence of proof before you take any regulatory action. Otherwise, it's far too late and you'll have an extensive burden of disease behind that. You need to be willing to take measures which will intervene before that point.
Only in plastics, recent studies show that you have 16,000 chemicals only for the plastic sector. You wanted to add something?
Yeah, just from the lead exposure example, when lead was first introduced to leaded gasoline, people knew factory workers had neurological issues, but that was okay. I think just the burden of proof, who should bear the burden of proof? It seems that, now there's new chemicals, new heavy metals, and when the research community finds health harms and then they become regulated, why should the burden of proof be borne by the general public? Why shouldn't it be the other way around? Before introducing a new chemical in a product, there should be a level of toxicology safety and epidemiology safety. That's a part of society that is beyond my scope, that I don't fully understand why the burden of proof is on the public, not on the producers.
Yeah, please, Excellency.
Just quick something, and maybe a message of hope. A couple of months ago, here in Geneva in March, it was launched the OQI, which is the Open Quantum Institute. And one of the ideas with the OQI is to take advantage of the upcoming revolution of quantum technologies. It will be here within 5, 10, 15 years. And for quantum technology, we will be actually able to get new materials and probably speed up the development of new components, of new chemicals, even of those of some technologies can reduce pollution. So I think that is something coming, and that all governments and all countries should take benefit of it. Thank you, and that's one again is a tribute to science. Thank you.
Before we close and Sarah takes the floor, I just want to, so we'll very soon close, so while you think at your 30 seconds message of what you take off this discussion, let's hear from...
Thank you, Diana. So thank you all for your contributions, and thank you to the public for your questions. Now, remember at the beginning we asked you a question, if we can see it again on the screen. So the correct answer was B, 7 million. You were 68% of you to get the right answer, whereas 28% of the room chose answer A, 10 million. 9% picked up answer C, 4 million, and 1% chose answer D, 1 million. So let's say it's not bad for a start. And indeed, air pollution, we've talked about it, indoors and outdoors, causes 7 million early deaths each year. This is from the WHO. And as we've seen, cleaner energy, better transport, and improved waste management can help fix this. So now, since it's a time for solution, what conclusions can we draw from all this discussion? Diana.
So I am turning back to my panel, and I will give them 30 seconds to close on what is their take-off of the discussion we have. We have heard a lot on that on this silent threat, not enough is done, and a few things emerged from the discussion. I think I will end with His Excellency Ambassador Espinosa, but we will start the reverse order. So Professor G.
Yeah, I just want to say I'm starting a class on planetary health, and that's a new topic that we ought to pay more attention to because we are needing of multidisciplinary work between chemists, between engineers, doctors, epidemiologists, and everybody need to work together on future pollution and planetary health issues.
Professor Quinsley.
Well, my message is one of optimism. Stay tuned, be ready to defend science, to do science, and to apply science to policy making and solutions, because there are solutions, and don't give up this optimism if you feel sometimes pessimistic.
Mr. Brown.
Take advantage of the direction of travel that we currently have with the global framework on chemicals, the upcoming plastics treaty, chemicals and pollution issues, climate change issues being on the agenda of the Health Assembly this year, next year, and in the new global framework of work. This is like a good direction of travel to get these issues an important place on the policy table, making sure that the health aspect is well addressed within that.
And Ambassador Espinosa?
Well, I think I would join Professor Kinsley on the message. Let us be optimistic, let us trust on science, and let us work together, civil society, public servants, diplomats, and scientists. Thank you.
Thank you all. So thank you for being with us for this panel. I think we can applaud our panelists. So there's a lot to do. Let's join forces and do it all together. Thank you.
Thank you, Mrs. Rizzolio. Thank you all for your contribution in this very inspiring discussion. Thank you also to you and for being here at the Geneva Health Forum. Time now for a coffee break, well deserved, and I'll see you back in 30 minutes at 11 for our next panel. Thank you.